Let me ask you something before we even begin. And I want you to really think about this. If I told you that a food sitting in your refrigerator right now, something you have probably eaten thousands of times throughout your life, could either be quietly protecting your kidneys or quietly damaging them depending entirely on how you eat it, would you want to know which one applies to you? Because that is precisely what we are going to talk about today. Eggs. This humble, ordinary, everyday food that so many of us over 50 have consumed our entire lives without giving it a second thought. I have had patients sit across from me, worried and sick, asking, "Doctor, is it the eggs? Is that what is hurting my kidneys?" And I have had other patients who ate eggs every single day and their kidney function remained remarkably stable well into their 70s and 80s. So, what is the difference? Why does the same food affect two different bodies in two completely different ways? That is what we are going to unpack today, slowly, carefully, the way I would explain it if you were sitting right here in my office. Now, before we go further, I want you to understand something about your kidneys that most people never learn until something goes wrong. Your kidneys are not just filters sitting quietly in your body doing nothing interesting. They are two of the hardest working organs you possess. Every single day, your kidneys filter approximately 120 to 150 quarts of blood. Think about that number for a moment. That is roughly the equivalent of filtering an entire bathtub of blood every single day just to remove waste, balance your fluids, control your blood pressure, and keep your electrolytes in proper balance. And here is the part that surprises people the most. Your kidneys can lose up to 90% of their function before you experience any obvious symptoms. 90%. That is precisely why kidney disease is often referred to as a silent condition. It does not announce itself with dramatic pain the way a heart attack might. It creeps in quietly, and by the time people notice fatigue, swelling in the ankles, or changes in urination, significant damage may have already occurred. This is exactly why what we eat, especially as we cross into our 50s, 60s, and beyond, matters so much more than it did when we were younger. When you were 25, your kidneys could handle almost anything you threw at them. They had reserve capacity, resilience, and the ability to bounce back quickly. But after 50, that reserve starts to shrink. It is simply part of the natural aging process. And this is where things start to look different for men and women. For men over 50, one of the biggest challenges is that kidney function often declines gradually alongside rising blood pressure and changes in prostate health. Many men do not realize that uncontrolled blood pressure is one of the leading causes of kidney strain over time. The kidneys and the cardiovascular system are deeply connected, almost like two dance partners moving together. When blood pressure rises and stays high, the delicate blood vessels inside the kidneys, the ones responsible for filtering waste, begin to experience unnecessary pressure and wear over the years. This can quietly reduce kidney efficiency. Add to this the fact that many men in this age group are also dealing with elevated cholesterol, blood sugar concerns, or the early stages of insulin resistance, and you can see how the kidneys become caught in the middle of several overlapping challenges. For women over 50, the picture involves an additional layer, and that is the hormonal shift that comes with menopause. Estrogen plays a protective role in blood vessel health throughout a woman's life, including the blood vessels within the kidneys. When estrogen levels decline during and after menopause, women can become more vulnerable to changes in blood pressure, cholesterol, and even bone density, all of which have downstream effects on kidney health. Many women also experience more frequent urinary tract concerns after 50, which, if left unaddressed, can sometimes affect kidney health over time. And because women are often the ones taking care of everyone else in the family, their own subtle symptoms of fatigue or changes in energy sometimes get dismissed or overlooked simply because there is no time to slow down and notice. So now you might be asking, what does any of this have to do with eggs? Stay with me because this is where it gets really interesting. Eggs contain one of the highest quality proteins found in any whole food. In fact, egg protein is often used as the benchmark the gold standard against which all other proteins are measured. This protein is essential for maintaining muscle mass, which becomes increasingly important after 50 because muscle loss, something we call sarcopenia, begins to accelerate with age. Strong muscles are not just about looking fit. They play a critical role in regulating blood sugar, supporting joint health, and even protecting kidney function indirectly by helping maintain a healthy metabolism. But here is the nuance that most people never hear about. Protein, including the protein from eggs, has to be filtered and processed by the kidneys. In someone with healthy kidney function, this is not a problem at all. The kidneys handle it efficiently, almost effortlessly. But in someone who already has reduced kidney function, whether from long-standing high blood pressure, diabetes, or simply the natural aging process, the way the body handles that protein load changes. This does not mean eggs are dangerous. It means the relationship between eggs and your kidneys depends entirely on the current state of your kidney health, how many eggs you are eating, and just as importantly, how you are eating them and what you are eating them alongside. This is the conversation nobody has with patients until something has already gone wrong. And that is exactly why we are having it today before anything goes wrong. So you can make informed choices rather than fearful guesses. Let us talk about the yolk because this is where most of the confusion and honestly most of the fear around eggs really comes from. For decades, people were told to throw away the yolk and only eat the egg white because the yolk contains cholesterol. I want to slow down here and really explain what is happening in your body because this old advice, while well-intentioned, missed some very important nuance. The cholesterol you eat in food and the cholesterol level in your blood are not the same simple equation that we once thought they were. Your liver actually produces the majority of the cholesterol circulating in your body, and it adjusts its own production based on what you consume. For most people, eating dietary cholesterol from a whole food like an egg has a much smaller impact on blood cholesterol than eating refined carbohydrates, sugar, and processed seed oils, which drive up inflammation and something called small, dense LDL particles, the truly problematic kind. The egg yolk, meanwhile, is where almost all the nutrition lives. It contains choline, a nutrient critical for brain health and liver function, something the vast majority of adults over 50 are actually deficient in without even knowing it. It contains vitamin D, which plays a role in calcium regulation and interestingly enough in kidney health as well, since your kidneys are involved in converting vitamin D into its active form. It contains lutein and zeaxanthin, which protect your eyes from age-related decline. And it contains a full spectrum of B vitamins that support energy production at the cellular level. So when someone eats only the egg white and discards the yolk, they are essentially throwing away most of the nutritional value and keeping mainly the protein. And remember what we just discussed. It is the protein load that your kidneys need to process carefully if kidney function is already compromised. So, in a strange twist, someone trying to protect their heart by eating only egg whites may actually be giving their kidneys a very concentrated protein load without the balancing nutrients that come packaged in the yolk. This is the kind of detail that gets lost when health advice gets oversimplified into headlines. Now let us talk about something that I find absolutely fascinating and that very few people ever discuss when it comes to eggs and kidney health, and that is timing. When you eat your eggs during the day can matter almost as much as how many you eat. Here is why. Your kidneys, like every organ in your body, follow a circadian rhythm. Filtration rate, blood flow to the kidneys, and even hormone levels that regulate fluid balance all shift throughout a 24-hour cycle. Generally speaking, kidney filtration tends to be more efficient during daylight hours and naturally slows down at night while your body rests. This is one of the reasons why eating a large protein-heavy meal very late at night can place a slightly different kind of demand on your kidneys compared to eating that same meal earlier in the day when your body's filtration systems are working at a more active pace. For someone over 50, especially if there is already some concern about blood pressure, blood sugar, or kidney function, I often suggest thinking about eggs as a wonderful breakfast or midday food rather than a late night meal. Eating eggs earlier in the day allows your body hours of active daylight metabolism to process that protein, utilize the amino acids for muscle repair, and clear out the byproducts efficiently before your body shifts into its nighttime resting and repair mode. This does not mean an egg at dinner is harmful for someone with healthy kidneys. But if you are someone managing early kidney concerns or simply want to optimize things as much as possible, shifting your egg consumption earlier in the day is a small, simple change that can make a meaningful difference over months and years. Another timing consideration involves spacing your protein intake throughout the day rather than consuming it all in one enormous meal. Your kidneys handle a steady, moderate protein load far more comfortably than one massive surge. So instead of eating 6 eggs in one sitting, which does happen more often than you might think, especially among men trying to build muscle or maintain strength after 50, it is far gentler on your kidneys to split that intake, perhaps 2 or 3 eggs at breakfast, and if more protein is needed throughout the day, sourcing it from other foods at different meals. Hydration plays a role here too. And this is something I really want to emphasize because it is so often overlooked. When you eat protein, including the protein from eggs, your kidneys need adequate water to efficiently filter out the metabolic byproducts, primarily something called urea. Many adults over 50 are chronically mildly dehydrated without even realizing it because the sensation of thirst naturally diminishes with age. Your body's thirst signal becomes less reliable, so you might genuinely not feel thirsty even when your body needs more fluids. If you are eating eggs regularly as a protein source but not drinking enough water throughout the day, you are essentially asking your kidneys to do the same important filtering job with less of the fluid support they need to do it comfortably. This is a simple, correctable habit. Keeping a glass of water beside your eggs at breakfast and making a conscious effort to drink water throughout the morning can meaningfully support the very process we are talking about. Let us also talk about what you eat your eggs with, because this matters more than people realize. Eggs paired with processed meats like sausage or heavily salted bacon introduce a significant sodium load alongside the protein. Sodium and kidney health are deeply connected since excess sodium makes your kidneys work harder to maintain fluid balance and can contribute to elevated blood pressure over time. So the picture is rarely about the egg in isolation. It is about the entire plate. Eggs paired with sauteed vegetables, a slice of whole grain toast, perhaps some avocado, create a very different metabolic and kidney related experience compared to eggs paired with processed salty breakfast meats and refined carbohydrates. Now, I want to bring something into this conversation that most people never connect to eggs at all, and that is blood sugar. This matters enormously for kidney health, perhaps more than almost anything else we have discussed so far. Diabetes and prediabetes are without question among the leading causes of kidney damage worldwide. When blood sugar remains elevated over long periods of time, it slowly damages the tiny blood vessels inside the kidneys, same delicate filtering structures we talked about earlier. This process can happen quietly for years before anyone notices anything is wrong. So the question becomes, where do eggs fit into this picture? Here is something that genuinely surprises many of my patients. Eggs themselves contain essentially no carbohydrates and have almost no direct impact on blood sugar. In fact, when eaten as part of a balanced meal, eggs can actually help stabilize blood sugar levels by slowing the digestion and absorption of any carbohydrates eaten alongside them. This is called a blunting effect. If you eat eggs together with, say, whole grain toast or fruit, the protein and fat in the eggs slow down how quickly sugar enters your bloodstream, preventing the sharp spike and subsequent crash that so many people experience after a carbohydrate-heavy breakfast alone. For someone over 50 who is trying to protect their kidneys, this blood sugar stabilizing effect is genuinely valuable because steadier blood sugar throughout the day means less cumulative stress on those small blood vessels inside your kidneys. However, and this is important, the way eggs are prepared can completely change this picture. An egg cooked simply in a small amount of healthy fat like olive oil or butter is a very different food from eggs scrambled with a large amount of cheese, cooked in heavily processed vegetable oil and served alongside hash browns and buttered white toast. It is not the egg that becomes the problem in that scenario. It is the entire context surrounding it. Many people believe they are eating a healthy protein-forward breakfast when in reality the meal has become a vehicle for excess refined carbohydrates, unhealthy fats, and sodium, all wrapped around a perfectly innocent egg. Let us also talk about something specific to kidney health, and that is a marker called protein in the urine, or what we sometimes call proteinuria. This is one of the earliest signs that kidneys may be under some degree of stress, and it is something your doctor can check with a simple urine test. If someone already has early signs of protein leaking into the urine, this is when the amount and type of dietary protein becomes especially important to monitor carefully. And this is genuinely a conversation to have directly with your physician because kidney health is not a one-size-fits-all situation. Someone with completely healthy kidney function can generally enjoy eggs as part of a balanced diet without concern. Someone in the early stages of kidney changes may benefit from a more measured approach, perhaps enjoying eggs a few times a week rather than daily, and being more mindful of overall protein intake across all meals, not just from eggs alone. I also want to address something that comes up constantly in my practice, and that is the fear so many people carry after simply hearing the word cholesterol connected to kidneys or heart health without understanding the fuller picture. Fear without understanding often leads people to eliminate a nutritious, affordable, versatile food from their diet entirely, sometimes unnecessarily. And this is where I always encourage people to get actual blood work done rather than making decisions based on assumptions. Simple panel checking kidney function markers, blood sugar, and cholesterol particles can tell you so much more than guessing ever could. Knowledge replaces fear with clarity, and clarity allows you to make food choices that are actually tailored to your own body rather than a generic rule that may or may not apply to you personally. Something else worth mentioning here involves the quality and source of the eggs themselves. Eggs from hens raised on diverse pasture-based diets tend to have a somewhat different fatty acid profile compared to eggs from hens raised exclusively on grain-based feed, often containing a more favorable balance of omega-3 fatty acids. While this is a smaller factor compared to overall dietary patterns, portion sizes, and lifestyle habits, it is still worth considering if you have access to pasture-raised or omega-3 enriched eggs, particularly since inflammation plays such a significant underlying role in both cardiovascular and kidney health as we age. Now let us step back for a moment from the plate itself and talk about the bigger picture, because eggs, or any single food for that matter, never exist in isolation from the rest of your lifestyle. Your kidneys do not care only about what is on your fork. They are deeply influenced by how you move, how you sleep, how you manage stress, and how consistently you monitor the numbers that matter most. Let us start with movement, because this is something I bring up with almost every patient over 50. Regular physical activity, even something as simple and accessible as a 30-minute daily walk, has a measurable positive effect on blood pressure and insulin sensitivity, both of which directly protect kidney function over time. When your muscles are active, they become more efficient at pulling glucose out of your bloodstream without requiring as much insulin, which reduces the overall metabolic burden your body carries. This matters enormously for kidney health because, as we discussed earlier, elevated blood sugar and elevated blood pressure are two of the biggest contributors to gradual kidney damage. You do not need to become a marathon runner at 55 or 65. Consistency matters far more than intensity. A daily walk, some light resistance training 2 or 3 times a week to preserve muscle mass, and simply avoiding long periods of sitting throughout the day can meaningfully support the same kidneys we have been talking about this entire time. Sleep is another piece of this puzzle that gets overlooked far too often. During deep sleep, your body regulates hormones that control blood pressure, appetite, and blood sugar. Poor sleep, especially chronic sleep deprivation, has been associated with higher blood pressure and less stable blood sugar control, both of which place additional strain on kidney function. Over the years, many adults over 50 experience changes in sleep quality, whether from hormonal shifts, stress, or simply the natural aging process. And addressing this, whether through a consistent bedtime routine, limiting screens before bed, or discussing persistent sleep issues with a physician, is not a small or cosmetic concern. It is directly tied to the same kidney health conversation we are having today. Stress deserves its own moment here as well. Chronic ongoing stress keeps cortisol levels elevated for extended periods, and elevated cortisol has downstream effects on blood pressure and blood sugar regulation. This is not about eliminating stress entirely because that is unrealistic for almost anyone living a full life. It is about building small, consistent practices that help your nervous system come back down to a calmer baseline regularly. Whether that is a few minutes of quiet breathing in the morning, time spent outdoors, prayer, meditation, or simply protecting time for hobbies and relationships that bring you genuine joy. These are not soft secondary suggestions. They have real, measurable physiological effects on the same blood vessels and organs we have been discussing this entire time. Now let us talk about monitoring, because this is where so many people over 50 could genuinely protect themselves simply by staying informed. Blood pressure should be checked regularly, and I mean actually checked, not assumed to be fine because you feel okay. Remember, kidney-related changes and blood pressure changes are often silent. A home blood pressure cuff is an inexpensive, valuable tool that allows you to track your numbers over time and notice trends before they become serious problems. Similarly, an annual blood panel that includes kidney function markers, specifically something called creatinine and an estimated glomerular filtration rate, along with a basic urine test to check for protein, gives you and your doctor real, concrete information rather than guesswork. This is especially important if you have any history of high blood pressure, diabetes, or a family history of kidney disease, since these factors increase your overall risk profile. I also want to gently mention something about certain medications that are extremely common among adults over 50, specifically regular use of over-the-counter pain relievers like ibuprofen or naproxen. These medications, when used occasionally, are generally fine for most people, but when used frequently over long periods of time for chronic pain management, they can place additional stress on kidney function, particularly in someone whose kidneys are already working harder due to age, blood pressure, or blood sugar concerns. This is absolutely a conversation to have with your physician rather than something to manage entirely on your own, but it is relevant context for this larger picture of protecting kidney health as we age. Let us bring everything together now, because I want you to walk away from this video with genuine clarity, not confusion, and certainly not fear. Eggs are not your enemy. For the overwhelming majority of people over 50, eggs remain one of the most nutrient-dense, affordable, and versatile foods available, and they can absolutely be part of a kidney-friendly, heart-friendly way of eating for years to come. The relationship between eggs and kidney health depends far less on the egg itself and far more on the full context surrounding it. Your current kidney function, how many eggs you eat, and how you space that intake throughout your week, what you eat alongside them, how hydrated you remain throughout the day, and the broader rhythm of movement, sleep, and stress management that shapes your overall metabolic health. If I could leave you with a handful of simple, practical habits today, they would look something like this. Enjoy your eggs earlier in the day rather than late at night, allowing your body's more active daylight metabolism to process that protein efficiently. Keep portions reasonable, perhaps 2 to 3 eggs at a sitting rather than large quantities all at once. And if you need more protein throughout the day, spread it across multiple meals rather than concentrating it all in one. Pair your eggs with vegetables, whole grains, and healthy fats rather than processed, salty breakfast meats. so the entire plate supports your kidneys rather than working against them. Drink a full glass of water alongside your breakfast and continue hydrating consistently throughout the day since your kidneys need that fluid support to do their job comfortably. Stay physically active in whatever way genuinely fits your life, whether that is walking, gardening, swimming, or light strength training, because movement protects the same blood vessels inside your kidneys that we have discussed throughout this entire video. Prioritize consistent quality sleep and find small sustainable ways to manage stress, because these are not separate from kidney health. They are woven directly into it. And finally, get your numbers checked. Blood pressure, blood sugar, kidney function markers, and a simple urine test. These are inexpensive, accessible tools that replace fear and guesswork with real, personalized information about your own body. If you already have diagnosed kidney disease, or if blood work has shown early signs of reduced kidney function, please have a direct, detailed conversation with your physician or a renal dietitian about your specific protein needs, because kidney health exists on a spectrum, and what is perfectly appropriate for someone with healthy kidney function may need to be adjusted for someone managing an existing condition. This video is meant to give you understanding and clarity, not to replace the personalized guidance only your own doctor can provide based on your own blood work and your own history. What I want you to take away from everything we have discussed today is this: growing older does not mean living in fear of the food on your plate. It means becoming more thoughtful, more informed, and more intentional about the choices you make every single day. Your kidneys have been working tirelessly for you since the day you were born, filtering, balancing, protecting you quietly in the background without ever asking for recognition. The least we can do, especially now in these years that matter so much, is to support them with the same care and attention they have always given us. If this video helped bring some clarity to a topic that so many people feel confused or anxious about, please consider giving it a like.